Anthony, if you have underlying heart issues, you need to take COVID-19 seriously. That is the message from the American Heart Association. The Heart Association says that it appears people over 65 with coronary heart disease and hypertension are more likely to develop severe symptoms from the coronavirus. And so that is why the AHA is committing $2.5 million to fast-track research efforts to try to better understand the coronavirus as it relates to heart and brain health, with the goal of developing more effective treatments quickly, potentially within the next 6 to 8 months. Now, reports are showing that people with high blood pressure or who have heart disease or have survived a stroke may be more vulnerable to the effects of COVID-19, with mortality rates 2 to 3 times higher than the general population. This afternoon, I spoke with Dr. Leslie Cooper, who is the chair of cardiology at the Mayo Clinic in Florida.
That report and others that are coming out very recently suggest that people who have structural heart disease, either because of hypertension, which causes a stiffening of the heart over many years, or because of blocked arteries in the heart, may have less reserve capacity, meaning that when they get a viral infection, their ability for their body to respond to that infection is limited. Those people are at higher risk of complications and mortality from the virus.
So if you fall into that high-risk category, Dr. Cooper says you should be avoiding large groups, self-isolating, and always practice good hand washing. And he says it's important to remember that the virus can live on surfaces for some time. So that's why it's so important to avoid touching your face, especially after you touch things like doorknobs. And he told me that if you do develop a cough or a fever, make sure that you contact your doctor right away.